Monsieur Thériault pour 6 minutes, s'il vous plaît.
And now to Mr. Thériault, 6 minutes. Thank you, Chair. And welcome, Honourable Minister. I will begin with a question that's slightly technical, and then I'll pick up on the drug bust carried out by the RCMP to learn a bit more about it. Now, the aim of 2023 was $144 million for the PODS program, the addiction treatment approach. This was to allow for public support and street workers and so on based on actual scientific data. And on the 1st of February, you stated that the new series of funding proposals had been accepted and were being reviewed and would shortly be announced and put into effect. First question. Have you reached the candidates for funding? Is this already underway, but the results not yet announced? Second question. You also said when you were asked about the funding of the safe supply funding projects, you said you got in touch with those in charge and all the programs now underway that are coming to an end will be refunded, but those that have appropriate mitigation measures. So what is that, the sort of appropriate mitigation measures? Those who are being funded, do they know they're getting new funding? And what sort of requirements are we referring to here?
Yes.
Je dois avoir les gens qui vous accompagnent faire les recherches que ma question est.
And I see the people with you are looking things up. It was slightly technical as a question. I'm sorry. We could also move on to another question if we need to wait for your officials to look up the material.
They're pulling some of the more technical details with pleasure. As many programs across the federal government, the SUOP program was very highly oversubscribed, showing that there is a high demand and need for services through SUOP in local communities. That being said, applicants have not yet been contacted in terms of who will be receiving funding. That will be forthcoming in the coming months. With regards to yeah,
and the mitigation issue.
The mitigation issues. So as I mentioned in my previous visit here, there are, and I will correct what I said previously about 21, there are 25 programs in the prescribed alternative stream that are funded by the federal government. A deep dive was done by officials, and Jen Sachs can go into further detail, but I can tell you it was a deep dive to ensure that there are mitigation protocols in place to prevent diversion. These include things like patient review of eligibility for prescribed alternatives, ensuring that they are on a regularized schedule, ensuring that there is ongoing contact and relations with those who are in the program. I'd also like to clarify prescriber alternative interventions are meant for those who have deep addictions to substance use, that without this entry point of assistance, they would turn to the illegal toxic drug supply and be at high risk for overdose death. But to speak more about the deeper dive details of what protocols were put in place, I'll ask Jen Sachs to answer if you don't mind.
Sure, happy to. Thanks. So we did take a number. On a pris plusieurs étapes pour.
So we went through several stages. We contacted all the projects that had applied, and with all of them, we asked for further information about their entire protocols regarding safety, safe supply, and risk reduction. Then we worked up all the measures that should be taken, and these will include, and I'll run them off in English because that'll be more efficient for me.
Patient risk or patient screening, efforts to better match drugs to the patient tolerance, so we've heard to make sure that it meets their needs in the increasing toxic drug supply, risk-based protocols for assessing patient eligibility for take-home dosing, patient monitoring, actions to address instances of diversion, which could include switching to observed dosing, transfer into different support services, and removal from program. There's more details behind each of those, but we pull together all of those lists. We are working with them to ensure they have the capacity to address those, and they need to be able to put those measures in place so that we can absolutely reduce those risks.
Parmi les mesures pour éviter les
Among the measures to avoid diversion, could you name a few of them?
C'est absolument.
Of course. And this is indeed to reduce diversion risk. We need to ensure that there's a screening of the patients, for example, that there are agreements with the doctor, the medical practitioner, and the client, linking the two with an agreement, and that
Basis for those take-home doses. We want to make sure that they have sufficient capacity for witness dosing where that is needed for that individual client, that there's regular urine and random urine drug screening test.
Est-ce que
Okay. Thank you, Mr. Thériault. This brings your time to an end.
Please, for 6 minutes.
Yeah, well, thank you, Mr. Chair, and thank you, Minister, for being here. I'm going to get right to questions quickly here. Minister, you talked about the importance of supervised consumption sites. My first question, will Health Canada step in to fill funding gaps for supervised consumption services, given the closure and threats of closure in Ontario and Alberta?
I want to thank the member for his question and also for his deep and strong advocacy in working in this space. We know how important it is to him. As the member knows, the federal government approves safe consumption sites to be open. We do not support their overall operating funds. We can support programs through SUOP within their facilities. But I need to be clear about this, that we take the lens that this is an interjurisdictional effort. That means that provinces need to be on board. They have signed bilateral agreements for mental health and substance use supports as a key principle. We've seen 37% of the funds allocated overall in bilateral agreements, which is more than a third of their own agreements towards mental health and substance use. But it is a healthcare service that we continue to push local jurisdictions to support.
Minister, I'll just add, we have seen deaths skyrocketing in Alberta and in Saskatchewan as well, where they're fighting safe consumption sites. That's not good enough. And I'll get to my next question. Minister, if the government believes substance use is truly a health issue, then why is the majority of funding for the Canadian Drugs and Substance Use Strategy going to law enforcement?
I'll thank the member for the question, and I'll say this, that when it comes to how we are tackling the opioid crisis, as I said in my earlier remarks, we're looking at a full continuum of supports that include enforcement. When we look at the breakdown of what we are doing, it's not an either or. Also, the enforcement funding that you are referencing is across departments, so it's not only from Health Canada that's contributing to those amounts. In terms of enforcement, it is also public safety and local jurisdictions. In terms of prevention and harm reduction, 61 million it was allocated to harm reduction between 2017 to 2022, and also 134 million to prevention. And in addition to that, 93 million to treatment. But again, this is a shared responsibility, respectfully, and
Minister?
in administering healthcare.
Go ahead, Mr. Johns.
Yeah, thanks. This gets right to the question that I want to ask, Minister. And you've heard me say this before, that, disinformation in a health crisis costs lives. Incrementalism in a health crisis costs lives. So, Minister, do you actually believe the funding allotted to address the substance use toxic drug crisis at the federal level is commensurate with the scale and scope of the toxic drug crisis taking place right now in this country?
I would say that since 2016, this government has ensured that over $1 billion has gone in towards addressing the toxic drug supply, which is substantially more than the previous government that had only allocated at the start of its tenure $30 million to treatment and reduced that by 2/3 by the time they exited their governing term. So from 30 million down to 10 million, this government has put in 1 billion in addition to the 25 billion that is part of the 200 billion that is going towards healthcare today. So I would hardly say that we've taken our foot off the gas, and I would reject that premise.
Well, I would reject that answer because I'll say this, Minister, you've spent less than 1% of what you spent, your government, in terms of responding to the COVID-19 crisis. And if you want to compare yourself to the Harper government, go right ahead. But we know they didn't take this issue seriously. So, Minister, I'm going to get to another question here. You know, in terms of, you know, we come out of the pandemic and we're now dealing with the cost of living crisis, greater access to mental health supports, housing's included, and it's needed more than ever. I've talked to your predecessor about the important need for funding for tiny homes, for example, so that we get people off the street into safe, secure housing, so that when they're ready for help, we can meet them where they're at. They can't get help when people are homeless. So how is your department working with the Minister of Housing to secure supportive and transitional housing? And we know the provinces will be there should there be capital funding for tiny homes, for example, and housing.
Thank you for the question, and I couldn't agree with you more, which is why we began to convene my counterparts on a quarterly basis on key issues that overlap and between departments. And one of the important conversations we had in our first quarterly meeting was exactly about that, of how were my provincial counterparts working with their local municipalities on the housing funding proposals that the Minister of Housing is negotiating jurisdiction by jurisdiction. We continue to work across departments to highlight that there needs to be a prioritization of complex need housing, including for those who are struggling with substances. We encourage municipalities, we'll be meeting with the FCM in the coming months also to ensure that avenues are open to include in their proposals to the federal government in the rapid housing strategy and housing strategy, that they are including those considerations in their funding grants through the federal government.
Thank you, Mr. Johns. Thank you, Minister. Next, Ms. Goodridge, please, for 5 minutes.
Thank you, Mr. Chair. Thank you, Mr. Chair, and I want to lend my voice in congratulating Dr. Lewis on his retirement. Minister, are you aware of government-funded so-called safe supply pills ending up in the hands of gangs?
I'm aware that the RCMP is actively involved in seizures across the country.
Fantastic. So you've said in this committee, you've said on Twitter that you're not concerned about the diversion because it's not widespread. So can you define to us what exactly widespread is?
Well, I think we need to look at it in terms of what prescriptions are out and who is using them across the country to get a better understanding of where diversion may be happening.
Thanks. So I guess I've done a little bit of math. So with about 4,500 people on safe supply programs in British Columbia, each receiving approximately 30 pills a day, that's about 50 million pills a year. So how many of those pills diverted a year would be acceptable to be diverted as far as you're concerned? To make it widespread enough.
As I said, well, let's look at some other numbers. There are approximately 115,000 people in BC with opioid use disorder, and 86% of hydromorphone pills distributed around the country are actually to cancer patients and those who suffer with arthritis.
Minister, these pills are being diverted into the hands of gangs who are profiting off the death of Canadians. So what specific concrete measures are you and your ministry taking to ensure that pills, and I don't care whether they're safe supply pills or other pills, are doing to not be diverted, causing further addiction and crime in our communities?
So as the RCMP Commissioner, John Brewer, said, there's currently no evidence to support a widespread diversion of safe supply drugs, but about 14% of the total number of hydromorphone pills that are prescribed around the country are going to safer supply.
Okay, so it sounds like doublespeak to me, because we have Prince George RCMP.
No, actually the data and the numbers. It's not doublespeak.
The Prince George RCMP have stated that they've found hydromorphone that was from safe supply programs in a recent drug bust. So the BC top police, probably from political interference, was told to downplay it and say that there isn't widespread diversion happening. But if it's happening in Prince George, it's happening on Vancouver Island, it's happening in communities all across Canada that have these so-called safe supply programs. So what specific actions are you taking with your SUOP grants to ensure that